Each and every day in our offices, we work as hard as we can to keep our patients healthy, to meet their care needs. And we find that as our patients get older or our patients get more chronic diseases or mental health conditions, their care needs become much more complex. And as hard as we can work, we can't possibly meet all of their care needs on our own. So we really need to reach out to our community care providers, our hospital providers, all of the people in the healthcare system in order to work together to coordinate care so that our patients can get the very best care possible.
The Community Care Access Centers act as an important collaborating partner for primary care. Think about it. We're moving into team-based care. That's an existing team that you can avail yourself of as a physician. And it is an organized team that has a multitude of services.
Family physicians are really in the trenches. We're seeing the usual primary care problems, but on top of that, our patients are living longer, and they're living longer with chronic disease. So it's tough for us to be able to do it all, and I believe, in fact, I've experienced the kind of support that a CCAC coordinator can provide. They can meet, they have the time to meet with a patient and their family and work out what exactly matters to them, build community resources around them, and in some cases even bring an interdisciplinary team into the picture to really support that family.
By working collaboratively within our integrated care team, including our primary care physicians, our CCAC team, our community partners, and the services available through the CCAC, the patients and the families really experience one team.
The one team approach is so vitally important when you think about the patients that we actually care about. That's often the medically complex, the elderly patients. In this situation, you have to approach it as one team that works hand in hand, integrated across different care sectors: the hospital, community care, family medicine.
Primary care integration not only helps physicians, but it helps all care providers within the system. If we work together, we can help each other, and our workload is much lighter, and the benefit is the patient gets better care.
Patients are really seeing a benefit. Now each member of the team is truly coming together, which is much different than what was happening before, when each member of the team was siloed.
The Community Care Access Centers in Ontario are part of that virtual team that family doctors can really avail themselves of. They are an organized group of care providers in the community that would provide us with a multitude of services. And I think that relationship is getting stronger.
I think in the past it's really been a challenge taking on these complex patients. Realistically, I and my staff don't have the time in our offices to be on the phone, to be organizing the many resources that patients like this need. Now with these new models of care, particularly with a dedicated CCAC coordinator that will communicate with me, that will coordinate the care, I have the kind of support that I was lacking and can actually accept more of these patients. And I really encourage my colleagues to do so, because you're not on your own anymore.
For more information, contact your local CCAC.